So at least once a day, I'll have a patient come up to me and say, I think that my pain is due to a trapped nerve. It's a term that gets thrown around quite a lot, but people don't really know what it means too well. Nerves can get trapped, and they usually have some very weird and wonderful symptoms associated with it. But I wanted to make this video just to talk through nerves, trapped nerves, and everything nerve related. So if we're going to talk a little bit about nerves, it probably makes sense to explain what nerves are. The way I often explain it to patients in my clinic is like if you were a house, the nerves would be your wiring. So much like the wiring in a house, which kind of goes through over and around different areas of the house and spreads throughout the house, our nerves spread throughout our whole body, and they're responsible for sending signals of actions to do or receive information from different areas of our body. What I mean by this is my nerves will send signals down towards my arm to get the muscle to contract, and when something touches my skin, it will send signals back up towards my brain to say something's touched your skin. Much like the wiring in a house as well, if something goes wrong with the wiring, if say there's an issue with one of the fuses in the fuse box, you don't know about it at the fuse box, you know about it because all of a sudden one of the lights goes out, and regardless of what you do with changing the bulb, nothing's going to affect it because you see the problem at the bulb level, but the problem is actually at the fuse box level. And that's why nerves can be a bit more fiddly, that's why nerve pain can be a bit more complex, and that's why things get a bit more confusing with it. That's also the reason why we take thorough time. If someone has something that may well be nerve pain, we take our time to test it as thoroughly as possible, and whenever someone does have pain in one area, we're always keeping an eye out to make sure that there isn't another cause from somewhere else in the body that's contributing towards it. So going back to what we said at the beginning, talking about trapped nerves, nerves genuinely can be trapped, they can be irritated, but they don't always behave the way that people expect them to. I'm going to go back to the fuse box analogy to talk about this in a bit more detail. Much like your fuse box, where if it's wired up right, you know where the different fuses go to and what's responsible for what. With the different levels of our spine going down, we know that roughly speaking, different levels of your spine correlate with different areas of your body where the nerves are going to be sending signals to and receiving them from. So often, if you do have an issue with a trapped nerve in your neck, that it's not at the neck where you feel it, it's usually down the arm where you feel it. And the things we'll often be looking for with, does the muscle function? Are the signals getting sent there? What's the sensation like? Are the signals being sent back up? And then, a bit more complicated, are the reflexes of those muscles or the muscles adjacent to it behaving the way that we expect them to? If you have a genuine trapped nerve, often you'll get weakness, you'll get numbness, you have changes in reflexes, sometimes really bad pain, but sometimes not as bad as you think. But those are the symptoms that often get associated with a trapped nerve, where it's not functioning, you're having a restriction in the function overall of your arm because of it. So I don't often like the term trapped nerve because people will often say I have a trapped nerve pain if they just have a little bit of discomfort around the neck. A trapped nerve is a real thing, but it's usually associated with the symptoms that I've described there as well. The main thing we do with physio is when you do have a pain that is a bit atypical, might be referred from somewhere else, we do go through and have a look at these things to make sure there isn't anything more sinister associated with that as well. So I hope you found this video useful. If you are suffering from any pain, be it nerve pain or any other form of musculoskeletal pain, please let us know and we'll be more than happy to help you out on the road to recovery. Thanks. Take care.